Here with Deirdre and Paul and Josh and David Lamont, and happy to answer your questions. Let me give you just a quick update on where we are in COVID. It's been a busy few days in our country, both with the election and what's going on with the pandemic. Want to put the first daily summary up there? What you'll see here, I think, is the positivity rate is and the current hospitalizations have leveled off just a little bit, but it's going to be bouncing around, and the trend has still been up. The fatalities are 11, disheartening number. I'd like to focus on the tests reported, 31,000 tests. Compare that to maybe getting 20 tests a day in back during the early days in the spring. We're trying to get the testing is almost more ubiquitous than it's ever been before. Easier to do, taking the PCR test to you with the mobile labs. And today I was at a McDonough school in Middletown where we had the Binax test, which I've talked to you about before, where you get a virtually instant response in about 15 minutes. And it's very accurate in terms of people with symptoms, what that means in terms of a school, what that means in terms of, look, if you have any type of symptoms, don't show up at school, don't go. But if you get those symptoms while you're at school, we give you that test, and we can get you a response within 15 minutes. That's allowing us to keep our schools open. But I say that in the sense that between the Binax test and the PCR testing and the wastewater and the saliva tests, there are lots of different categories how we're trying to stay ahead of this infection as best we can. That said, we still have some work to do. Look at the next chart. This is our version of the measles map. You maybe remember from just 3 weeks ago, there were 4 towns on it, and then there were 30 towns on it, and now there are 42 towns on this map. And it represents about 60% of our population. Red meaning you have 15 COVID cases detected per 100,000 on a daily basis. This is a map that suggests that while we have moved to statewide protocols, no more trying to just put out the fire in a local municipality. And I'm afraid to say that this is the map. When we had our quarantine, it was, remember, around the country. It was limited to just several states, and then it ended up being virtually for every state in the country. So you see this map on an expanded basis nationwide. If you're straining your eyes, you can go to ct.gov, COVID. You can look up your town, ct.gov, schools. You can see exactly what's going on in your schools. So you have in no uncertain terms exactly what's going on. It also reminds us that back in the spring, COVID was more limited. Remember, it was just the southern part of the state, and back then we could have a mutual aid in the northern part of the state. Hartford and Trinity could provide some nursing and some vents and the help. And we were able to help New York when they were most on fire, so we were able to triage and move our people around, and actually able to do that in different parts of the country as well. Well, today you don't have that opportunity, so that is an extra reason why we are monitoring hospital capacity very well, because we don't have a lot of easy overflow to the northern part of the state or the southern part of the state. So that's the reason that we are moving towards these statewide protocols. We sort of previewed them a few days ago, and this is going to be the executive order that goes into effect at midnight tonight. A couple of reminders in here and a couple of small changes. Restaurants, we've taken from 75% to 50% capacity, a little more spacing, 6 people to the table. I think before we had maybe tried a little more than that. And that's because you had some big parties at these tables that involved eating, but involved a lot more than that, and we thought this was safer to do. We listened to the restaurants, and we've also worked with our fellow governors, especially Charlie Baker up in Massachusetts. So we've said, look, the last service, last call at the restaurant is going to be 9:30 p.m., and the dining room will close at 10. Give people a little bit more breathing room there. But they can continue to do takeout, as you remember, just like we have in the past. Personal services, 75%, no change there. Gathering sizes, I want you to focus on the private gatherings. This is something we're doing in association with all of our governors in the region. And that's because, as you remember Deirdre saying this some weeks ago, it's those informal private gatherings where we're seeing the ignition taking off in terms of the infection rate. So no more than 10, indoor or outdoor. That's a tough one. I got to count on your self-monitoring this as well as you can. You know, Thanksgiving dinner, 10. That dinner party, 10. And we're really recommending that people, you know, be home by 10 o'clock at night. You see that at the bottom there. Same protocols as Rhode Island and Massachusetts, I might add, as well. It's just a little easier to stay safe, stay at home. Performing arts capacity at 100, religious gatherings, no change there. Anything you can do virtually for business, anything you can do virtually with those religious gatherings is really recommended. Religious gatherings sometimes attract a slightly older demographic. Better to stay safe, stay at home. Let me talk now about the sports sector, which we've alluded to in the past. It took a little more time for us to clarify, because I really wanted to do this with Rhode Island and Massachusetts. No hosting in Connecticut of any of these regional competitions or tournaments. You've heard us say before, we are having a lot of folks coming in from out of state for hockey tournaments and the such, and we got to stay closer to home. So we're not going to allow that. Massachusetts is not going to allow that. Rhode Island is not going to allow that. New York has really, cut way back on any competition regarding high school sports, period. So that means no Connecticut team will travel out of state for games. That's going to start on Monday. My recommendation is for these things, don't do it this weekend. No high-risk sports. I'll get to exactly what they are in a minute. Will be played for the rest of 2020. Don't worry, you'll see that the medium-risk sports, hockey, basketball, the ones you're most used to, are still allowed. But for those indoor sports, like hockey and basketball, wear a mask. That's true of our neighboring states as well, all trying to enforce this. New Hampshire's been doing this for hockey for, now a few weeks anyway, finding we're able to do this safely. We were sitting on the side of the rink, 12 of you lined up, wearing the mask. It's so important. And we're going to be asking the leagues and the such to come up with the protocols necessary regarding spectators. We're saying 2 family members per competitor. Rosters, that's really important. If DPH asks, if your local public health department asks, tell us who's on the roster for that hockey team, that hockey game. If there's an infection, we need to know that. Give us their contact information so we can do a prompt track and trace and really try and limit the spread as best we can. This next chart just gives you a little more indication of what are the high-risk sports that we don't want to have played between now and the end of the year, will not be played between now and the end of the year, and what are those medium-risk sports. And before we start, fussing and how come this is here and that's there, we decided to just rely upon the National Federation of High School Sports. So this is not uniform. Every state's doing their thing, but we've just taken the protocols as set by the National Association and run with that. So I'm afraid that means that wrestling and, as you know, 11-on-11 football, not to be played, boxing, competitive cheer between now and the end of the year. And in the yellow are those sports that are medium risk, which you can play more cautiously, but no out-of-state tournaments, no going out-of-state to play, and that includes, basketball and hockey, indoor sports, which will be played with a mask. So we're doing everything we can to allow our sports and schools to go as best as we can, doing everything we can to keep you safe because we're not out of the woods yet. And we got some work to do, and that's true of our state, which is still 8th lowest infection rate in the country, but I take no solace in that at all. And there is risk, and I'm seeing what's going on in some of those other states which have an infection rate of 30, 40%. So let's err on the side of caution a little bit longer. With that, we have a stand-in, Rob Blanchard, who can handle the calls.
All right, thank you. We'll start with the Hartford Current. Okay, we'll move on to Hearst, Connecticut Media.
Hey, good afternoon, Governor. So first question is, with the restriction on 10 people, how do you expect people to go along with that? I mean, just over the last weekend, we saw some gatherings at restaurants and such. How do you expect to enforce that, and do you think people will actually go along with it?
I think Connecticut's been pretty good on that so far. First of all, you're right, in the restaurants, some of the bigger crowds there, that's why 9:30, 10 o'clock close was much easier to enforce. And when it comes to a private gathering at your home, we're just telling you, use your judgment. If you can limit it to 10 and your neighbors limit it to 10, and we can put up with this, just like they are in our neighboring states, we're all going to be better off for it.
All right, Connecticut Mirror. CT News Junkie.
Thanks, Rob. Can everybody hear me?
Yes.
Okay, good. Governor, talk a little, if you could, about Thanksgiving. That's going to be limited to 10 people as well?
That's going to be limited to 10 people. We've talked about this before. I've talked about this with our governors in neighboring states. Look, it's a tough pill to swallow. I get it. We've talked about that before, but do it now. Do it this Thanksgiving. Put up with this a little bit longer. We're going to be much better off for the long term.
Right. And the 6 people at a table, that's down from what you said earlier, right? Were you saying eight people at a table in a restaurant when we talked initially about the phase 2 go back?
Is that a change, David?
Yeah, Governor, if I may, that was a typo that I should have caught earlier. We are at 8 people per table, and that is where we were on Monday, and we continue to be at 8 people per table.
Thank you.
Okay, right. As far as schools go, Governor, is there any metric of infection rates in a town or statewide where you would recommend schools sort of revert back to the strictly remote learning?
Well, I think you saw in Danbury, they got up to 7 or 8% infection rate. They decided not to open at that point. Norwich got a little higher, and they went to remote learning. By the same token, as I've said this before, I look at places like France, Germany, and Britain, which have much higher infection rates, and they have kept their schools open. They really made that an absolute priority. And it's worth noting, even as our infection rate has crept up from 1% to 3.5 or 4, our infection rates in the schools has been much less than that. Especially for the younger grades, it's still, relatively speaking, the safest place to be. But I'm hoping we can keep that going a while longer.
So there's no certain number per 100,000 infections where the state would say, okay, it's time to, let's go ahead and move back to remote.
No, not at this point. We still left that up to the judgment of the school districts themselves.
Okay. All right. Thank you, everybody.
All right, thank you. We'll come back to the Hartford Current.
Hey, everybody. This is Emily Brinley from the Current. Sorry about that earlier. Governor, could you explain a bit about limiting the private gatherings to a maximum of 10 people? That's a pretty significant change. Can you explain a little bit about the logic behind that?
Yeah, I'll start, and then maybe you guys can help me out. But as you heard from Dr. Birx, as you heard from Deirdre, as we've heard from all the experts, it's these small, informal, private gatherings, often at our homes. We're most likely to let our guard down. It's a friend or a friend of the friends. We feel like, okay, that's fine. And it's our strong feeling that if we can limit those private gatherings for a period of time, it will make a real difference. Obviously, it makes a big difference in terms of track and trace as well and getting ahead of this. But Josh or Deirdre, do you want to add to that?
I would just reiterate what you said, Governor, which is exactly the case. This has been nationally a source of spread of COVID. And as we see our level of community transmission continue to increase in Connecticut, that just means the odds that someone you have over to your home, unfortunately, is even that much more likely to have an asymptomatic or mildly symptomatic case of COVID. We tend to let down our guard a little bit in terms of masks and distancing when we're inside our own homes. So for all of those reasons, it makes a lot of sense, and we think it will really significantly help our transmission if we limit the gatherings. It's a painful thing to be discussing at the holidays, but it's a really important step for all of us to consider taking, given where we are now with the community transmission in Connecticut.
Thank you. And if we're talking about a cap of 10 people at gatherings, can you explain why that isn't a concern with classrooms, which obviously usually have many more than 10 children in them?
Well, I'll start with that. First of all, the infection rate we're finding in schools, especially at the lower grades, much less likely to be shedding the virus. We found around the country, around the world, as well as Connecticut, that wearing a mask in the classroom is one of the safest places to be right now. We found that most of our school-related infections actually happen outside of the classroom, maybe the hybrid or the remote learners. But any of you want to add to that?
Yeah, I would say that many of the measures that the governor and Commissioner Lamont have been talking about are designed to support us to be able to continue to have in-person learning because it's so critical for our children. And so some of these things are really, the goals of these activities really are not only to prevent infections, preserve our hospital and healthcare capacity, as the governor said, but to contain the community spread as much as possible so we can preserve the ability for kids to continue to go to school because it's important for them and their well-being to be able to do so.
And one last clarification question on the sports rules that you just announced, Governor. It says, you said no, that's all right. You said medium-risk sports must wear a mask. Is that during gameplay that they must wear a mask?
That's right. We're doing that in association. Rhode Island's doing this. Massachusetts, New Hampshire has been doing this. We're finding that the kids are able to make that work okay. Look, this does not include college and professional sports. We're really focused on K through 12, doing everything we can to allow them to continue to play sports safely.
So you're saying not just masks on the sidelines, but while players are playing as well?
That's right.
Okay, thank you.
All right, thank you. Waterbury, Republican American.
Thanks very much. This year, Thanksgiving is on November 26th. On December 25th, there's another big holiday gathering that tends to bring families together. What are the possibility of this 10-person limit being in place at Christmas time?
Well, I'll start, and maybe I can hand it over to Josh. I mean, I think you heard from a lot of the science folks that have come, including Dr. Murphy from New Vance, that a lot of our models show that this infection rate may continue to climb through the end of this year. We're doing everything we can to contain that, but they said the same thing in France and Germany and some parts of the Midwest, and it did continue to climb. So, look, I'm always looking for a light at the end of the tunnel, but it's a little further off.
Dr. Gifford?
Want that, Deirdre?
Yes, I echo the governor's comments on that. I think it's we have a ways to go here, and we're need to take these steps now to turn this increase around. But it's likely that we'll continue to see this these cases into December.
What is the current 7-day rolling average of positive test rates that the state is using?
It's 3.5, Paul.
3.5. And how does that compare to, say, June? Another high from June or something like that?
It's actually down a tick from the last couple of days, but yeah, it compares roughly to where we were in early June.
Okay. I know we asked earlier, Governor, at the Middletown event, but is there any timetable regarding the distribution or at least the expansion of this pilot program? I mean, to see how these tests work out and identify any snags that need to be worked out?
Yeah, what Paul's referring to and I alluded to was Middletown is our first K through 12. We're rolling out the antigen testing, the Binax, as well as bringing in the PCR testing, so that we'll be able to get ahead of infections in the K through 12 level. And based upon what we see going on in Middletown, I think you heard Miguel Cordona, the Commissioner of Education, say we want to roll this out statewide. We'll have to see what the protocols are, and we're limited a little bit by the nature of the Binax tests we do get from the federal government, but they've promised us 1 million tests by the end of this year. Right now we're at about 150,000 tests, and so far so good.
Okay, and you know, I know you've sort of alluded to this in your discussion of this 10-person limit, but what can you tell Connecticut as we verge on this rollback in our reopening rules about how long that this may last?
I think we sort of alluded to that before, but a lot of the models suggest that this could go, you know, through the end of this year. But as Josh has pointed out many times, models are models, and they can change all the time. And through our behavior, we have some ability to flatten that curve, which will allow us to get back to a new normal a little sooner.
And just one last question: have you, is your administration at all talking to New York State about a 9:30 cutoff on table service? I was just looking at the rules earlier today, and it looks like they're sort of doing their restaurant regulation on a COVID-19 rate base, sort of a cluster system.
Well, you're exactly right about that, Paul. We've had some conversations, and Paul Mounds has talked to their chief of staff quite a bit, and I'll let him. But basically, they're still not doing anything on a statewide basis for reasons, you know, they're a big state. So they've got their pockets, for example, in parts of Brooklyn and Queens. There, they've got 25% capacity in their restaurants, where we're, say, at 50% capacity. But they have other parts of the state that are up at 50%. They have not capped at 9:30 at this point in the city that never sleeps. But I think it's something they may be looking at as well as time goes on.
Yeah, just to echo the governor's comments, as we do with all of our guidance and any of the changes that we make, we share that information with our regional partners. As you all know, New York, New Jersey, going all the way down to Delaware, just for best practices showing. But as the governor stated, yes, they are going based upon their regional basis, based upon their system that they have put up, county by county. But we will continue to have conversations with New York, as we will with all of our regional partners. But we're happy to have some alignment with our partners to the north and to the east right now.
Well, really, because I thought, excuse me, I know it's the last question, but Rhode Island, I believe, allows service after 11 o'clock, no alcohol, and bar areas have to be closed. But I don't believe Rhode Island has announced a 9:30 cutoff yet, have they?
I think they may be a little bit later, but we're 100% aligned with Massachusetts.
Okay, all right, thank you very much.
Thank you, Paul. The Day of New London. All right, Connecticut Public Media. Associated Press.
Thanks, Rob. Good afternoon, everyone. Governor, I had a couple questions about the sports changes. Does this eliminate the 11-on-11 independent high school football league that's been set up?
I believe it does, as of Monday when it goes into effect.
Okay. And also, what does this mean for that bubble that they have planned at Mohegan Sun for college basketball? I understand that a UConn player just tested positive.
Yeah, I think I'll pass that one over to Paul. He's been in contact with UConn, but you're right about the bubble. I mean, college sports, they're much able to keep within their cohort in a way that's more complicated for high school and elementary school sports. So that's why we've allowed the sports to continue at places like UConn. Paul, anything about that infection?
Yeah, we were alerted by UConn Athletics before they put out their announcement that a player on the UConn Huskies men's basketball team has tested positive for COVID-19. They are taking all the necessary protocols, including shutting down their practice facility for cleaning. As you know, the UConn Athletics has a very aggressive testing protocol for their student athletes, and the Department of Public Health will continue their conversations as they have been throughout this whole crisis with UConn Athletics, and we provided a more formal update in the coming day.
So, Paul, the bubble is going to move forward? No plans to change?
Yeah, as the governor stated earlier, the protocols that we put forth are for K through 12. And I know in our conversations with Mohegan Sun, UConn Athletics, they're very aggressive in terms of their protocols, particularly on the testing that will be done in that bubble. And we will be continuously working with Mohegan Sun, who's been a great partner with Department of Public Health and with DECD and David Lamont, in providing us thorough updates in any of their developments going forward.
Thanks for that. And yesterday, Governor, I understand Governor Cuomo, he issued some new rules for travelers, and I know that Connecticut is exempt, but I just wanted to see if Connecticut is planning some of the same things. Like, for instance, travelers have to get tested within 3 days prior to landing in New York, and they have to quarantine at least 3 days upon arrival. You have to get a new test on day 4. If both are negative, then you can leave quarantine. And then there was something, too, about if a traveler is out of state for less than 24 hours, you don't need to quarantine, but then you have to check in and have take a test on day 4. Is Connecticut planning any of that type of stuff?
Well, I'll start. I mean, man, that's complicated, isn't it?
I know.
I think the bottom line is, look, you're much better off if you quarantined for all the different testing protocols, and that's how we started. We had a lot of people that couldn't necessarily do that 14-day quarantine. So we said, look, if you test before you come for a few days and test when you get here, do that. But maybe Deirdre can talk a little bit about our quarantine, especially as it regards, we're going to have thousands of students coming back from college, some from very infected regions. What do we recommend there?
Yeah. So as the governor mentioned on Monday when he announced some of these changes in the sector rules, it really is now a good idea to limit all non-essential travel as much as possible. So that's the first thing to say, is that we're continuing to recommend that if you don't have to travel, stay close to home. And our travel advisory does continue to say that if you're coming to Connecticut, if you've been out of the state for more than 24 hours, or if you're coming here from another state that's on our list, you should take a test before you leave your home state. If you don't do that, you need to quarantine when you arrive in Connecticut, or take a test on arrival, and you should remain quarantined until you take a test. So it's limit travel and get a test before you leave your home state, and quarantine as much as possible until you get a negative test in Connecticut.
Okay, thanks. Thank you very much, everyone.
Thank you, Sue. News 8.
So is there any evidence, the track and trace, we say that schools are a safe place for children. What does it look like for sporting events? Are you seeing the transmission of the disease on sporting teams during track and trace?
Well, I'll start, but as you know, we've seen a lot of infections in and around sports, in and around hockey. That's why Massachusetts paused or closed down their hockey rinks, their skating rinks for a couple of weeks. until we could get in place some rules that made it safer to be able to play these games in terms of what goes on, not in the locker room, wearing the masks and the such. Anybody else want to take a crack at that question? That's it.
No, all right. So you haven't seen any, like the track and trace, there hasn't been. I guess that's done at the local level.
Well,
so
what we did want to do
about...
was, look, we were having a hard time with some of these teams, and they had an infection. We said, who else was, in close contact with that infected player, and not everybody was responding. So one of the rules you saw in place is, look, if your team is going to be playing, we'd like to know who's on the roster and how we can contact them if there is an infection. That way, your team can continue to play safely, and it's much less likely when the team goes back to high school or whatever it is, we've got the virus more contained.
Yeah, so we have seen, Governor, to add to that, a really big impact on our local health departments on the contact tracing related to sports. So we've seen, obviously, because we're seeing more COVID in the community, we're seeing more players on these various teams that have a COVID infection. As the governor alluded to, have been able to trace back some outbreaks related to at least hockey. But the real struggle for our local health departments, who are quite busy right now with their all of the enforcement and contact tracing that they're doing, is that when they have particularly a school kid that's on a team and if they've been at a tournament exposed to COVID, then the contact tracing is very challenging and time consuming. And they're telling us it's beginning to impact the ability of some schools to remain open because so many kids are being asked to quarantine, and sometimes it's teachers as well if they're acting as coaches. So it's sort of a compounding effect of infections related to the sports, but also just the follow-on effects of having an infected child that played in a game or a tournament.
Thank you.
Thank you, Bob. Channel 3, Eyewitness News.
Yes, a question for Dr. Gifford. We're seeing towns with an infection rate on that red alert list that just spikes to the point where they're really just skipping the orange alert and just going straight to red. Is that unusual, or is that to be expected in this second wave?
Well, to a certain extent, this is the nature of this virus. As you've heard me say before, it's a highly contagious virus. And so when you get to a certain level of virus in the community and you're having lots of contacts, that's when you start to see that kind of exponential increase in cases. And we're fortunate in Connecticut that we've got a lot of testing going on, so we're actually able to watch that now in a way that we didn't see it back in the spring. But I think the point that the governor and Josh and myself have all been trying to make is that when you get to a level of community prevalence of this virus, your odds of bumping into somebody in any kind of activity, whether it's low risk, medium risk, or high risk, your odds of bumping into somebody with COVID goes up quite a bit. So that's why the governor's actions are meant to reduce those types of activities, and particularly those that are high risk, because we need to start breaking that cycle of transmission.
Got it. Question for the governor. Phase 2.1, it's not going to really affect the tribal casinos, and we haven't heard of any changes on our end that's going to be happening. What conversations have you had with them, and what were the results of that?
We're having very positive conversations. As they know, our 2.1 is limiting restaurants and certainly alcohol after a certain hour, 9:30. We'd like to see them follow similar protocols. I can tell you that Massachusetts and Rhode Island, we're having very similar discussions as well. We'd like to do that as close as we can as one. I don't want a lot of people from Rhode Island saying, hey, let's drive to Connecticut, or vice versa. So I think we'll have some good announcements to make on that very soon.
Perfect. And final question now for Mr. Lamont. Are there any details on any financial support for the impacted businesses as we enter phase 2.1?
Thank you for the question. So the main program that we have out there is the Small Business Assistance Grant Program, which is $50 million, where we think we can help up to 10,000 small businesses across the state of Connecticut that have suffered a 20% or more revenue drop this year. Beyond that, we're certainly happy to consider other programs, and as we go through this winter and fall here, we want to better get a sense of what this impact is. And of course, as the governor's mentioned, all eyes are on Washington, D.C. as well for stimulus here as we get past the presidential race.
All right, thank you. NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. It looks like we got about a quarter of towns that now fall underneath that red alert. I'm just wondering, with that many, is there a certain point that we're going to hit when this list just becomes unworkable and that we just need to either change the metrics or just change the system itself?
Yeah, man, I think we are changing the system. Look, it's still worthwhile for you to see where your town is, where your region is in terms of the heat map and infection. But you're absolutely right. I mean, right now it encompasses 60% of our population. So that's why we're doing everything on a statewide basis and even more importantly on a regional basis, sort of similar to where we were 6 months ago.
And then also had a question. New Haven had a warning for a Walmart there that might be potentially shut down because of repeated COVID-related violations. Were you made aware of that case, and overall, do you think enforcement needs to get tougher with businesses that are not complying?
I don't know about that particular case. Maybe one of you guys do. But look, I think we got to be tough on this enforcement. It's no fair for those overwhelming majority of stores that are open. They're staying open. We haven't limited their ability to keep open, unlike in Europe where they all had to shut down. So if you want to be able to keep your store open, especially if you're a Walmart, a big brand name like that, lead by example. And yeah, there will be consequences if there are violations.
Okay, thank you.
Thank you. Fox 61.
Hi, everyone. So Governor Lamont, if I'm understanding correctly, it's probably the most important to limit the private gatherings to stop the spread, but that's also harder to enforce. So are there any specific enforcement measures you're considering, or is this more of an honor system?
Look, we're obviously strict on enforcement in those commercial establishments and those event venues and those bars/restaurants. What goes on in your home is going to be more in the honor system, but Connecticut's pretty good at the honor system.
And then I actually have an election question for you. If Vice President Biden wins and asks you to serve federally in any capacity, will you leave the governor's office in Connecticut to do that?
No, I'll tell him I got the best job in the world right here in Connecticut, and we still have a lot of work to do. How can I help you from Connecticut?
Thanks.
News 12 Connecticut.
Good afternoon. A lot of restaurants we spoke with today say they haven't received any guidance yet. They just heard on Monday at the press conference that they had to close early. Is that guidance going to be up on the state's website by 12 a.m. tonight?
Thank you for the question. It's David Lamont. That guidance is actually up on the DECD website right now. We just put it out at 4 o'clock.
Thank you. And a lot of the restaurants we spoke with today, again, are saying that they've heard over and over the governor say the CDC and contact tracing shows the spread is not through restaurants. And of course, they're very frustrated by this executive order. Just wondering your response to that, Governor.
I'll let Deirdre, because she can give you some of the numbers that we've seen on restaurants. But look, when you have community spread, it's more broadly in the community than it was, say, a month ago. And if you have 100 people in a restaurant, you got a 4% positivity rate, 4 of them in there. So you're right. Spacing is really important. Those protocols are more important than ever. 9:30 is important. And look, I'm doing everything I can to keep the restaurants open. We can only do it if people feel safe there. But Deirdre, what do your numbers show?
Yeah, so of course, as this pandemic progresses, we learn more and more about where spread is likely to happen, and that knowledge base is changing all the time. So I certainly understand questions about why this setting, et cetera. a couple things unique to restaurants, and it's just, by the nature of their business, we're not wearing masks. We often have people from unrelated households at the same table. And so those are the types of conditions where you are more likely to see spread. They're indoors, and at least when we're talking about indoor dining. There was, as David Lamont mentioned, there was a CDC study that came out, I think it was around 6 weeks ago. It was a preliminary study, but it did suggest much higher odds of having been in a restaurant for people that had COVID compared to people that didn't have COVID. And finally, I would say that over the last couple of months at the Department of Public Health, we've been doing some work with our local health department partners to look at outbreaks. We can trace, we have a lot of cases now, but in some cases we can trace groups of infections back to a certain location or type of venue. And restaurants is one of the more common places where we've seen outbreaks related. So, put all those things together, the nature of the venue, the CDC study, our contact tracing, and, the international experience, it does indicate that restaurants do pose some increased risk.
All right. WTIC 1080 News.
Hi, David. How tough could this holiday season get for retailers? We've spoken a lot about the restaurants, but what about the stores? Do you have numbers on how much they'll be off?
So thank you for the question. Retail, it's obviously a significant industry, and we are very mindful how important November and December in particular are for retail. The one thing we have seen, though, since May when we reopened retail is the retail experience. It is quite possible to distance. Masks are worn the whole time, and it's typically a short duration experience. You're in the store for 15 minutes, maybe 30, 45 minutes, depending on what you're shopping for. So from a health risk perspective, we're actually quite comfortable with retail. And going into Main Street shops or other big box stores, we think that's something that folks can do safely because of the three reasons I just mentioned. So we're hopeful that customers and consumers will have confidence to do that, but to also embrace the safeguards while shopping for the holidays.
And Mr. Governor, Joe Biden, according to the AP, is 6 electoral votes out from becoming president-elect. Are you hearing security concerns from state police and so on? I know there's a lot of tension over this, let's put it that way.
There's a lot of hot rhetoric on social media, and our state police are monitoring that very carefully. But right now, there's nothing happening here in the state of Connecticut. We're going to keep it that way.
If that does happen tonight, you want to preview your reaction to what apparently is going to happen?
Well, look, I've seen around the country, as you have, that stores are boarding up. They've been hit before. They don't want to break another window. There's fears of vandalism, maybe folks upset with the outcome one way or the other. But look, I think at the end of the day, the people of Connecticut are going to handle this responsibly and coalesce around the next president of the United States.
Yeah, I was going for your reaction on Biden becoming president, potentially.
Look, I think, A, we need clarity. B, I don't do a lot of politics here, but most people know I supported Joe Biden pretty early on, and I think he's going to make a big difference for our state. When it comes to state and local aid that allows all of our states to power through that recession, it's going to be really important for us.
Thank you.
All right, that's the signal from Rob Blanchard. As you can see on here, I just wanted to say this is the election that never ends. I mean, we all started voting a month before Election Day, or many people did, and it's now a couple days later, and we're seeking resolution soon, as we just alluded to. But I was really proud of the fact that we had the largest turnout, I think, in the history of the state. I'm proud of the fact that Connecticut voted. Many voted absentee, which I think was appropriate, especially given the nature of COVID and how it hits the older population. I'm proud of the fact that people lined up there, you see, with their masks going forward. And I'm proud of the fact that despite all the noise in and around politics, people know that their vote makes a difference. And I guess there's an older guy with his younger wife in the other frame. Anyway, have a great fun this weekend with your 9 best friends.